Thanks for joining us for this next part of our special series on vaping. As we first explained, the CDC said they were seriously considering an interview with us. Then a couple months later, they ran from the camera when met with a challenge of answering tough yet fair and balanced questions, which, for the record, I even sent the CDC prior to the interview per their request. When the CDC dodged us, I contacted the FDA, eventually met with the same tactic. After a back and forth for months, they were reluctant to answer questions, refusing to be interviewed on camera. That did not stop me from my fact-finding search for the truth about vaping, good or bad. So I decided to interview quite possibly the most influential and authoritative health agency, the World Health Organization, or WHO, in Geneva, Switzerland. This is one of the first one-on-one television news interviews with the WHO and the US, specifically about vaping, a topic they are also now monitoring. I spoke via Skype with Vinayak Prasad, a medical doctor who directs their tobacco unit. Here is our exclusive interview with the World Health Organization. I don't want anyone to be in danger, and I in no way endorse vaping or e-cigs. However, I cannot dismiss the argument of what people who vape are telling me, that they have tried every means possible to stop smoking and nothing has helped them except these vape products.
So I cannot answer this question because the evidence is still out there, number one. Two, more than half of those who are trying to use e-cigarettes to help them as a quit device are still using tobacco. And it's well established that dual use is actually very harmful, more harmful. So no point reducing my use of cigarettes from 20 cigarettes down to 15 and then using e-cigarettes. It adds to dual complications. So there's a whole group of people who have not reached out to you. So what are the harms? In a society where more than 25% of middle school children and more than almost 30% of high school children are consuming, using some form of e-cigarette, or as the industry will call it, vaping devices, the harm is that we are creating a new generation of addicts. And that is the biggest problem which we are seeing in the US currently, that e-cigarette use has reached epidemic proportions. One, more children are starting to use e-cigarettes. Two, we are not seeing sufficiently good evidence that these are helping adults quit. And when I say quit, because majority of them continue to be dual users. So the benefits of any, if perceived benefits of any e-cigarette use for smokers is there, that's not there. That's not there on record. That's not there to show that this is helping the adult population quit 100%. And it is also not there to show that it's protecting the younger people. And we saw more than 60 deaths in the US confirmed amongst younger people. That, to me, is a huge public health concern. When we see no established benefit or proof that this is a quit device. The point I'm making is that when we have other options to help smokers quit, we need to encourage population-level quitting options, because this is a tool which has been created by the tobacco and nicotine industry, and they're pushing this without sufficient evidence.
Yet with all that said, Vinayak, you certainly have science and data that your WHO researches and studies, although hundreds of thousands, if not millions, of people who vape here in the United States insist that vaping has saved their lives from smoking. They tell me of stories where they've gone to the doctor and they used to have emphysema or COPD or lung damage, and then months later after vaping, or a couple of years later, they say the doctor says they're okay, their x-rays look good, and they again claim vaping is the only thing that has allowed them to stop smoking. What do you say to that, given the fact that you have all the concerns about the dangers of vaping and e-cigs?
So the long-term health effects of electronic cigarettes is not known. These are relatively new products. So if there are adult tobacco smokers who have not been able to quit using other means, and they have been able to switch to electronic cigarettes and they find it useful. We do not know for now, and we cannot comment on the long-term health effects of these. So to say that these are less harmful, I would not subscribe and ascribe to it. That there are more than 30 countries that have banned these products. And these range from developed world economies like Singapore, Hong Kong, to developing world economies like India, and to LDC countries in Africa. So it's a whole range of countries that have banned these products. And it's quite obvious why they have banned it. Because we do not know the long-term effects of these products. We do not know for sure how it's helping people quit, if at all. Then why should they be allowed to be introduced in markets and create a new set of addicts?
Yet, when you speak of other countries, and you have the data, certainly, when you look at, say, for example, the UK, the medical community in England seems to believe that vaping products, e-cigs, are good for harm reduction and are promoting the fact that the vaping and e-cigs could be a good alternative to stop people from smoking with all the deaths worldwide. It seems that, at the very least, the UK takes a much more lenient approach than the United States does with its strict and stringent rules and regulations here.
Not true, actually. Not true. I don't think US has taken a more stringent approach than the rest of the world. It's actually not. It's been least regulated of products in the US, and that's why it's currently at the state at which it is. UK has followed the EU directive on tobacco product regulation, and many of the provisions of this TPD apply for the UK market as well. And I see UK as kind of an experiment, because that's the only country which is, as per their own reports, seeing a trend in terms of adults being able to quit and all that. I'm not seeing similar reporting or similar patterns in other countries. So it's too early to comment on UK.
What is the WHO doing to try to get the word out to the public all around the world about, as you say, the harms of vaping and e-cigs, while understanding that hundreds of thousands of vape shop owners could be put out of business?
Let's not use this argument, which is basically a ploy of the tobacco industry. It doesn't work like that. If the vape shops were not able to sell vapes, tomorrow they'll sell something else. It's a market they look for. I mean, imagine a situation where in California you can't smoke in a public place, and somebody with an e-cig comes and smokes in a public place. Why? Why should it be allowed? Imagine a situation where you're allowed advertisements. You're not allowing for tobacco. Why would I allow for e-cigarettes? Because that's what has happened. E-cigarettes have been allowed to be advertised, and you have 30% of high school children with e-cigarette addiction. So US FDA is rightly looking to regulate it.
Is there anything that the vape industry, the vape community could do to possibly prove to public health agencies, WHO, FDA, CDC, that these products are safe?
The vape industry is the tobacco industry, the nicotine industry. The victim is those who are consuming these products. We shouldn't conflate this. I'm trying to protect my future generation of American children from electronic cigarettes. I'm protecting my future. Why should the vape adults should worry? They are consuming vape. They should vape. They should continue to vape. They are not the scientists. They are not the industry. They shouldn't speak for the industry. And we are here to give advice, and governments are here to help people quit both tobacco and e-cigarettes.
Vinayak Prasad of the World Health Organization, thank you very much for this interview.
Thank you.